I haven't left my house in over 2 weeks. Why, you ask? The US and the rest of the world are facing an international pandemic known as the coronavirus. My high school, DeSoto Central, and the entire state of Mississippi have closed classes to help prevent the spread of this deadly disease. Myself, along with millions of other students across the US, have effectively been sent home. Although I nor the rest of the world were familiar with this disease until a few months ago, the coronavirus, also known as COVID-19, has invaded its way into our news feeds, our discussions, and our timelines. Today, I hope to share with you the history of the coronavirus, how the disease has spread and how it is spreading throughout the globe, and ways to prevent spread. To understand what we are dealing with in the COVID-19, we must go back to the beginning. The first known case was announced to have happened in Wuhan, China. The exact source is unknown and is still trying to be determined by health officials. The Scripps Research Institute states that on December 31st of last year, the Chinese authorities alerted World Health Organizations of an outbreak of a novel strain of the coronavirus causing severe illness. Subsequently, it was named SARS-CoV-2. On February 20th, 2020, nearly 167,500 corona cases have been documented. Lawrence Sarr of Johns Hopkins stated, early on there was a hypothesis that had linked the virus to a seafood market in Wuhan, China. People who visited the market had experienced viral pneumonia caused by this new coronavirus. However, Sarr later stated, studies came out on January 25th, 2020, that the first person who had been infected became ill on December 31st and had no link to the seafood market. An investigation is still ongoing to the origin and spread. As we move forward, the focus shifts from where the virus originated from to how and why it's spreading throughout the world. We know that it spreads from person to person or from close contact within 6 feet. But when asking why or how the virus has spread from China, New York Times investigators found that the original outbreak occurred during Chinese New Year, which is one of the busiest times for tourists in China. And this further expanded its reach around the world. The CDC has also noted that there can be a risk from the respiratory drops from an infected person's coughs or sneezes. And it has also been noted that when the spread of the sickness is most volatile when the person is at their sickest, though there have been cases where the person has not shown any symptoms and still spread the disease. This is not the main way of spreading, though. Johns Hopkins Medical has found that symptoms in a person occur within 14 days of exposure to the disease. The CDC has also discovered that the disease can be found on contaminated surfaces and objects in public places. Coronavirus will change everything going forward. It will. New York Governor Andrew Cuomo, nobody can tell you when it ends. Nobody can tell you when you're going back to work. There are several ways to prevent the spread and prevent COVID-19. Recognize symptoms, such as a dry cough, a fever, or shortness of breath, and take the necessary steps to alienate yourself from large groups of people. This is also known as self-quarantine. Make sure you're washing and keeping your hands clean constantly and avoiding contact with people in public areas. Avoid touching your face and surfaces when you're in public areas. And you may also be able to use gloves to avoid touching contaminated objects. We all need to learn how to practice social distancing. This will be able to immensely lower the spread of COVID-19. And the CDC also urges us to cover our mouths whenever we sneeze or cough in a public area. One other tip they give is don't panic and don't take misinformation off the internet. With this new knowledge of the coronavirus's history, ways it spreads, and how to prevent infection, I hope I was able to keep you and your family safe. Today, in the US, there are over 100,000 cases and rising. New York State is over half of those confirmed cases and is a prime example of not following prevention protocols and requisitions. New York City is also heavy in civilian foot traffic and is also another prime example of not following proper social distancing, and is why they are experiencing a surge in the number of infected peoples. Whereas we as a society need to come together at a distance and adhere to the professionals and CDC's suggestion for keeping this virus to a halt. I hope this insight and information was helpful to you and your community, and you are able to stay healthy and safe.